Awesome.
Well, good morning, everyone, and welcome to our webinar hosted by Drug Free America Foundation and the National Drug Free Workplace Alliance, and supported also through Recovery Friendly Workplaces New Hampshire and Career Source Pinellas. The program today is entitled Recovery Friendly Workplaces. My name is Karen Bellinger, and I'm the Program Director for Drug Free America Foundation. And just a few housekeeping items. First, please feel free to introduce yourself in the chat box. And we encourage you to write any questions that you have in the Q&A box. And the final 10 minutes or so will be devoted to responding to your questions. The webinar is recorded and you will receive a link to it along with the PowerPoint presentations and a certificate for attendance. That'll be coming in by email like next week. And there will also be a link to the survey, which will be sent almost immediately following this webinar. So please complete it as soon as possible. And if you are not already a member of the International Society of Substance Use Professionals, we want to encourage anyone that is in the any substance use field to please consider becoming a member of that. And we will include that also in the post-webinar follow-up email with the links and such. We'll have all that there. And finally, we will include you on all future invitations to webinars that we have coming up in the future. So let's get started. So first, I have a brief bio on our first presenter, Samantha Lewandowski. She's MS, and Samantha is the Program Director of New Hampshire's Recovery Friendly Workplace Initiative. She first served as a Recovery Friendly Advisor for the initiative, where she worked one-on-one with over 80 workplaces and then became its Assistant Director. She manages the day-to-day operations of the initiative, including overseeing the staff and subcontractors, ensuring workplaces are supported in the recovery-friendly workplace process, and promoting effective collaboration with partners, as well as helping develop and implement the initiative's strategic plan. She's also currently serving as the Recovery Friendly Workplaces multi-state liaison, where she provides technical assistance to other states looking to implement the New Hampshire model. This includes leading a quarterly community of practice that convenes recovery-friendly workplace-related entities across the nation, with over 25 states represented. She first began working with individuals in substance use disorder back in 2013 through a residential harm reduction program. Samantha holds a Master's of Science in Community Development and Applied Economics from the University of Vermont, and a Bachelor of Arts in Sociology and Anthropology, and a Bachelor of Science in Environmental Science from Loyola University in Chicago. She's also a loved one and an ally of people in recovery, as well as a trained recovery coach. Welcome, Samantha.
Thank you, Karen. I appreciate that. And hello to everybody in the States and abroad. It's so exciting to see the diversity of people we have who are interested in this topic. And thank you for that introduction, Karen. So I'm just going to jump right into my presentation. So here we go. So today I'm going to be talking a little bit more about New Hampshire's Recovery Friendly Workplace Initiative. Specifically, I'm going to be briefly introducing the concepts of substance use disorder and recovery. I am going to talk about recovery friendly workplace and why it's good for business and also employees. And then talk a little bit about RFW process and culture, so a little bit more the nuts and bolts of our initiative. And then talking about some resources in New Hampshire and beyond New Hampshire. So first of all, I just wanted to kind of go over these terms of substance use disorder, which you'll also hear me refer to as SUD, and then also recovery. So what is substance use disorder? So the American Society of Addiction Medicine adopted the following definition pretty recently in 2019, which is that addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. People with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. They also go on to note that prevention efforts and treatment approaches for addiction are generally as successful as those for other chronic diseases. So I just wanted to highlight this so we all kind of have an understanding of that medical definition of what substance use disorder is, that it can include this part that people can engage in things that become compulsive and continue despite harmful consequences, but also that prevention efforts and treatment approaches are generally as successful as they are for other chronic diseases. So what is recovery? So coming from the collective wisdom of people in recovery, researchers and thought leaders, we're going to run through two quick definitions. So the first comes from a summit that the Substance Abuse and Mental Health Services Administration held back in around 2012. So they came up with the definition that recovery is a process of change through which people improve their health and wellness, live self-directed lives, and strive to reach their full potential. And then we also have this definition from a recovery scientist, Dr. Robert Ashford, and he writes that recovery is an individualized, intentional, dynamic, and relational process involving sustained efforts to improve wellness. And so what's interesting is that in both of these definitions, we see the terms process and wellness highlighted, actually not a reference to any specific substances, and really this person-driven approach. And what we kind of say, if you're trained in the recovery coaching space, is that a person's in recovery when they say they're in recovery. So now a little bit more about the Recovery Friendly Workplace Initiative. So we are an initiative of Governor Sununu, and we were launched in March of 2018. And currently we're actually administered by Granite United Way, which is a nonprofit organization. You might have heard of the national entity, just United Way. And so we're administered by them in partnership with the state of New Hampshire. And really our initiative is all about promoting health, safety, and wellness for our workplaces, employees, and communities. And more specifically, we do this by empowering workplaces to provide support for those who are in recovery, seeking recovery, not yet in recovery, as well as loved ones who are impacted. A huge part of this work involves challenging the stigma around substance use disorder. And overall, we feel that this approach is going to encourage employee retention and productivity. A little bit more just about our org chart. So I kind of went over the relationship here, and this is actually just slightly out of date because I was promoted from assistant director to program director. We actually don't have an assistant director currently. Here's our United Way entity. We all obviously report to the governor's office. We're overseen by an advisory council that is made up of business leaders, people from the healthcare sector, people from the recovery community, and the public health space. And so that's great because it's kind of like a built-in focus group almost that we get to do every 2 months, and they provide high-level guidance on the initiative. And then I oversee 4 staff members. It's a really critical position. Those are our recovery-friendly advisors. They're the ones who are working one-on-one with our workplaces, guiding them through our recovery-friendly workplace process. And then we also partner closely with our 13 public health networks and also our recovery community organizations, which provide very low barrier, no cost, peer-based supports. And really what we're trying to do is break down silos and convene a lot of different supports to kind of wrap the workplace in support when it comes to recovery and substance use disorder. Some key accomplishments of the initiative to date. So our team is fully staffed, which we're happy about. We've been able to secure additional funding opportunities through the New Hampshire Community Development Finance Authority, and also federal opportunities through the CARES Act and American Rescue Plan Act to build relationships with partners and really deepen the breadth and the depth of work that we're able to do with our workplaces. We started out with 25 early adopter businesses, and we now have over 330 workplaces participating, representing over 86,000 employees. If you look on the right, that's just kind of a snapshot of some of the logos of our participating workplaces. People have been engaged in RFW activities over 24,700 times. We built out over 16 different recovery-friendly workplace trainings and trained over 200 businesses. We've made connections to over 25 other states. We've been able to develop a lot of additional marketing materials and assets, including 7 testimonials. And we're currently working towards an evidence-based certification through New Hampshire's Service to Science process, including completing our first ever all RFW business survey, which I'm really excited about because for the first time in like a public presentation, I'm going to be able to share some of the results from that survey. So how do we support our recovery-friendly workplaces? So we offer a customized approach because we know that, say, a small mom and pop shop is going to have very different needs than a large manufacturer. We get people connected to statewide, local, and even national resources. We have a huge database of resources, and we really curate those for each workplace. We provide support for employees and their loved ones. We offer no-cost trainings. We found that this is one of the things our employers are actually most interested in. We can share policy resources and samples, as well as there's some really great toolkits that go over content around this area as well. Another big part is Recovery from the Workplace is really a movement that is designed to raise the visibility of the impact SUD can have, but also the hope that recovery holds. And with that, really challenge the stigma around it. And a big part is getting workplaces connected to peers in this network of recovery-friendly workplaces. So people who are further along in their journey, who can kind of mentor other people who are just starting out. We can provide support if people want to form an RFW committee, or maybe they want to do a workplace survey to get a little bit more information. We can provide workforce development connections to programs in the state that are working to connect job seekers to workplaces. And then we really just provide kind of that ongoing dialogue and structure when it comes to this process. Like we're a cheerleader if they need a cheerleader, or like a coach, or, you know, just a friendly face to kind of keep them moving along. And why should employers get involved? We know that there's significant costs associated with not addressing substance use disorder in the workplace. So you might be familiar with the National Safety Council's substance use employer calculator. And then what we like people to think of, though, is that this isn't just an issue that exists out there. It's not just something where once you start becoming a recovery-friendly workplace, you're kind of pulling the issue out of the weeds. It's something that is already in your workplace. You're already employing people with substance use disorder or who are impacted in some way. So we know that about 10% of people currently have a substance use disorder. We know that about 9% of people have resolved a substance use disorder in the past year. So we could roughly look at these people as being in recovery. They may or may not identify with that term. And then we know that nearly 1 in 2 people are indirectly impacted. If we expand these numbers to include those who are impacted by mental health, it just blooms even further. And I mentioned the attracting and retaining talent benefit, which we'll talk about a little bit more when we go over the survey results. And then here's just some additional benefits, and they will be sending out a PDF of my slides. So I might jump through some of them kind of quick and just reference what information you'll find where, but we'll cover a lot of ground today. So just a few statistics kind of supporting why employers should get involved. Some of these are a little bit old now. Actually, this was from June of 2020. And there was a study that reported that 40% of US adults had reported struggling with mental health or substance use. So just an incredibly high number. Then I highlighted some other statistics here. So the American Medical Association noted that 40+ states had seen increases in opioid-related mortality. There was another study that reported that nearly 1 in 5 people had reported engaging in heavy drinking. And then there's a great organization called Mental Health America, and they have screening tools, and they had reported a 500% increase in self-directed mental health screenings. And then this chart is just showing the increase in depression symptoms before and after COVID. So during COVID is this blue bar, and we basically just seeing the severity of mental health depression increasing. So it's I probably don't really have to convince many people on here why it's an issue, and it's important to kind of have a recovery-friendly approach to try to be more preventative in nature. So both preventing issues from arising before they get to be, you know, full-blown substance use disorder, but also preventing the progression of severity and having the tools and resources to kind of intervene and get people connected to support sooner rather than later. In terms of saving money, though, so these statistics come from the National Safety Council, and a study that they did with the NORC at the University of Chicago. So they found that workers in recovery help employers avoid over $4,000 in turnover and replacement costs. Workers in recovery miss 13.7 days less per year than workers with a substance use disorder. And each employee who recovers from an SUD saves a company over $8,500 on average. And then I like this slide in particular because it really highlights not just when someone doesn't have a substance use disorder, but people in recovery and the strengths they bring. So they miss fewer days as compared to the general workforce, and their turnover rate is less as compared to the general workforce. And then I'm really excited to be able to share, like I said, the results from our recovery-friendly workplace survey. We administered this survey to our points of contact at our recovery-friendly workplaces. And what we found was kind of what our tagline is, which is that recovery-friendly workplaces are good for employees and good for business. I know this is kind of small, so it'll be helpful maybe when you have the slides and you can zoom in. Let's see if I can. I don't know, hopefully that's zoomed on your side. But so we asked respondents, as a result of participating in recovery-friendly workplace, how have you seen the following items change? And this is just a sampling. We asked more questions than this, but here's, I'll just highlight a few statistics. So supervisors' confidence in knowing how to respond to employee concerns about substance use. 70% of our points of contact responded that they saw an increase in this as a result of participating in recovery-friendly workplace. Much more knowledge about resources available for SUD treatment and recovery, employees being more willing to discuss the issues that they're experiencing, a greater willingness to hire people in recovery, better workplace morale and satisfaction. And then we did a combined statistic. So keep in mind that this is a longer term statistic. So when we did our logic model, we had short-term, intermediate term, and long-term outcomes. And so longer term outcomes of participating in something like this would be the recruitment, retention, and productivity. So the fact that almost a third of our points of contact have started seeing benefits in that space is really quite impressive from a public health and kind of data and evaluation standpoint. We also have some great statistics around Narcan. So people are much more familiar with how to use Narcan. It's become more accessible in the workplace. And then we saw high levels of engagement with our RFW activities. One thing we are really excited about is this statistic here. So as you probably know, policy can be a really important part of changing workplace culture. So we know that from the research, changing policies to better support those who are impacted by SUD will help employers recruit and retain a healthier, more productive, and more motivated workforce. We actually cite the studies, some studies that reference this down here. And along those lines, nearly 40% of our employers had indicated that as a result of becoming an RFW, they had made changes to their substance-related policies to better support those who are impacted by SUD, for example, through leave of absence or return to work agreements. And then we asked people what are some of the most meaningful ways that their workplace has changed as a result of becoming an RFW. And we have some really great responses here. And I love just kind of the simple one, employees know we care, which is kind of just what we're going for. Okay, so now the trick is going to be, can I unzoom? I'm not going to show this video now, but when you get the slides, you can click on this title of the slide and you can see one of our video testimonials. Okay, a little bit more. So I talked about kind of recovery-friendly workplace, impact, why is it important? And then I wanted to talk a little bit more about like, what is it? What is the process we follow? So everything that kind of undergirds our process follows this one-page checklist. And so there's 3 sections of this checklist. We have the initial required components, the additional required components, and then a set of optional components. And so our initial required components for our workplaces, so they would go on our website, recoveryfriendlyworkplace.com. They would click on join us. And then we have a kind of quick letter of interest form that they fill out. It's about 10 questions, and it just gives us a little bit of background information about the company. And then they submit that. And then from there, we get them connected to one of our 4 recovery-friendly advisors, which is that staff position that I mentioned earlier. And then the advisor, the assigned advisor, would go out, possibly with some community partners, and do a full orientation to the program, ideally with senior leadership, maybe some management, and also HR to kind of get that top-down buy-in going. And then at that time, we're kind of assessing culture as well, and needs, and kind of where they're at along this continuum of culture change. And then we ask that they make a declaration to their employees stating that they are participating in the initiative and that they are committed to its principles. And we ask that they get that out in a couple of ways. So ideally, they have a written version, and we really encourage people to over message things when it comes to wellness. It really can take repeat messaging for employees to fully believe, like, okay, this is a thing that we're doing. This is actually creating that concept of psychological safety. You know, I'm actually safe to come forward. So the declaration is a big part of kind of helping challenge that stigma, create that visibility, and creating that safe place. And then we get them an initial recovery-friendly workplace designation. So the advisor would go out, or we can also do it virtually. We do a swap of branded elements. We give them our logo to use. We put their logo on our website. We do a social media post. And then we're really kind of moving into a conversation about next steps and how they want to proceed. And the advisor can also offer guidance and insights there. And then we move into the middle section of the checklist, which they have an additional year to complete. And that looks like getting information and resources out to employees and their loved ones on recovery and well-being, getting connected to their local recovery community organization, which, like I mentioned before, provides that no cost, low barrier, peer-based support. So it's not clinical, it's not like treatment or detox, it's different than that. We ask that they review any substance related policies that they have. We don't mandate that employers create or change policies, but we definitely invite them to review through that recovery-friendly lens. We can have very high-level conversations around policies. We can't get way into the weeds because we're not HR or legal, but we, thanks to having certain champion RFWs, we can get them connected to some peers. We do have a couple of sample policies. And then actually, I'm really excited because with some of our ARPA dollars, we've actually been able to secure an attorney who's going to be doing a training a little bit more specifically on this area, since we are asked about it so often. And then we ask that our RFWs do some kind of education and training in the course of the year. We have over 16 at no cost that we can provide. We also have a learning management platform in case that kind of virtual self-paced access is easier. And then at the end of the year, we ask that they do a designation renewal form with us, where we just kind of go through and talk about what they did to meet each of these requirements. And then we also have a section for reflections and goal setting. And then optional components include creating an RFW committee and getting involved in community-based events, and then also just really coming up with customized implementation strategies. So we always love having those conversations with businesses where they're like, how can we give back? Or we want to do more, or they just kind of come up with creative ways to implement. So some examples are some employers have brought recovery meetings on site. Some employers have let people stay on the clock to attend recovery meetings because they see that an employee's recovery is part of being able to still, go to work and maintain their job. We've had restaurants and other events other venues want to host recovery-friendly workplace events. We've even done a recovery fashion show. That was super cool. So just seeing all of the creative ways people can take this is really inspiring. And then here are some of our trainings. So I probably don't need to go into all of them, but basically this kind of goes through the different formats of in-person or online, or only online. I will say that people do a fair amount of Narcan training with us. And with that, we're often able to distribute Narcan, which is great. We have 2 different panels. So we have, I can't find my arrow anymore, but we have our, what we call our lived experience panel and then our business panel. So the lived experience panel is people talking about their kind of strength, experience, and hope going through substance use disorder and reaching recovery. And we're often told that that's one of our most impactful trainings. Our business panel is, again, kind of those peers, those champions coming together to talk about, from the business perspective, what policies, practices, and procedures do they have in place? What outcomes have they seen? And then giving other businesses the opportunity to ask them questions. And really what we're going for is a culture of support. So this quote came from one of our RFW employees, and it's kind of a cool and powerful story. So he actually started kind of on the production lines at one of our manufacturers. He ended up being promoted to a manager, and then he actually ended up leaving on very good terms to start his own recovery home. But this quote came from him when he was working at that manufacturer. He said that every time I walk into work, GenFoot, and see that symbol, so the recovery friendly workplace symbol, it gives me a little more hope that people do care. So at the end of the day, you know, that's kind of what we're going for. And then I just wanted to provide some examples of some of the education and resources we're providing to our workplaces. So an example would be like a language training. So teaching people about evidence-based language that helps to challenge the stigma around substance use disorder. So overall, this language is really person first, person-centered language. So instead of saying that someone is an addict, a junkie, a druggie, an alcoholic, which just equates the person with the condition, we would say that they're a person with a substance use disorder, which is the DSM term for addiction. Or instead of saying alcoholic, we would say person with an alcohol use disorder. You can say person with an opioid use disorder. And this really works well for a variety of conditions. Instead of saying someone's a schizophrenic, where you equate them with the condition, a person with schizophrenia. One that I like to highlight around mental health is, instead of saying committed suicide, saying that somebody died by suicide. Really, we're taking terms that we have certain really negative associations with and swapping them out for more neutral, person-centered approaches. So instead of saying substance abuse, so abuse typically is something that a person does to another living thing. So we can't really abuse an inanimate object. And when we say that, it tends to bring up really negative connotations. So instead of saying substance use or misuse, instead of using words like dirty and clean, which kind of had these moral connotations, saying things like a positive or negative drug screen, someone maintained their recovery instead of stayed clean. Having said that, we also definitely acknowledge people's autonomy to tell their stories in a way that makes sense if they're in recovery. We just invite people to always consider their audience. And there's some more research on like context appropriate language. So like if you're in a meeting, a recovery meeting, it might be very common to hear other lingo, but maybe if you're presenting to a board of directors, you choose to use different language that you know will combat stigma instead of kind of add to it. And then in New Hampshire, so kind of our key resources we refer to are, so every state in the United States has a 211 information and referral line. And in New Hampshire, we're really lucky because that interfaces with a system called the New Hampshire Doorway System. And so there are 9 doorways in the state designed to have help never more than an hour away. So what happens is if somebody is seeking substance use disorder support, they call 211 and then they can get transferred to one of our 9 doorway systems. So the doorway is going to serve as a centralized kind of intake hub. They do an intake and an assessment and help people determine the appropriate level of care that they need and help them navigate treatment options. So instead of that person having to call, 50 places on their own, they can kind of help take some of that burden off of the individual, which can also be a really alienating and shaming process. So just trying to make that a little bit smoother. And then also as the person's coming out of treatment, they can provide case management services, and it's kind of a hub and spoke model. So they can refer to ancillary recovery supports as well. And then I talked about our recovery community organizations. And then we actually have, if you click on this image, I believe, it will take you to a video that talks a little bit more about how 211, the doorway, and our recovery community organizations all kind of interface to support people who are impacted by substance use disorder. So a little bit more about what employers can do. And we have a lot more content on this area, but I just wanted to kind of include a snapshot. So you can develop and implement a process when it comes to creating a recovery-friendly workplace. So some examples of that would be forming an RFW committee or doing that survey, or maybe a focus group listening session to kind of get more information about, you know, how are we going to roll this out at our workplace. So what's nice about our initiative is, of course, we provide that checklist process, but then we kind of leave it up to the business to kind of steer what it looks like within those parameters. Parity in policies. So really what we're going for is, let's treat substance use disorder, which is a health condition, like we would other health conditions. So if we have compassion for somebody who is getting chemo and is not feeling well, let's have compassion for somebody who has a substance use disorder, who's trying to overcome it, who maybe is having health complications. Maybe they need medication assisted treatment. Maybe they need some time off to go to a recovery meeting. So if I would let somebody who needed to get chemo or who had diabetes, take an hour maybe on the clock or off the clock to go do what they needed to do, I should then consider doing the same allowance for somebody with a substance use disorder, since they are both just health conditions that somebody did not, you know, choose to have. It's also important to train supervisors to make sure that they are educated using the appropriate language, they're supportive, they know the policies, they know where the workplace stands on recovery-friendly workplace. So people aren't hearing one thing from upper levels of management, but then in terms of their direct supervisors kind of experiencing something that doesn't align with that. We want to, of course, reduce the risk of injury. This is its whole own field and sector. This is going to help ensure that people would be less likely to be prescribed pain medications, which could become habit forming. Participating in drug take-back events is a great preventative approach. And then distributing Narcan and having that on site to help in the case of an opioid overdose. I have 2 case studies. So this case study comes from one of our workplaces, Hypertherm. They're one of our kind of longest time champions. They were doing this work actually before Recovery Friendly Workplace was even around. And so this just shows kind of all the options and pathways to support. So when I think of a recovery friendly workplace, and kind of ideally, I think it's one where people would know the different options. They would know what their workplace's policies are, where they can look those up, where their workplace stands. And then they have options to seek support either within or outside the workplace, because some people just might not feel comfortable getting support through the workplace. So at Hypertherm, people could go internally to human resources, to a team leader. They also have an EAP, and they worked with their EAP to actually bump up the number of substance use disorder sessions that were covered. They also worked with their EAP to make sure that they were better integrated with their local resources. They have trained recovery champions who are briefed on resources and can kind of get people connected to resources there if people didn't want to go to more of like a leadership person in leadership. And then they also have an external facing, they had an internal facing, and maybe they still do, but they also have an external facing webpage that has resources on substance use disorder. They also have physical resource cards in their bathrooms in particular. And they did a really cool thing where they paired this with a recovery bracelet initially. And within a couple of days, when they were first starting out, almost everybody was wearing one of these bracelets. And that's when they really knew that they were onto something. And then they also have an MLADAC. So LADAC stands for Licensed Alcohol and Drug Counselor. And MLADAC is somebody who has a master's in that. They have an MLADAC who comes and provides supports for a few hours each week. And then this case study comes from our manufacturer, another champion, GenFoot America. And so since the time that they had become a recovery friendly workplace, 5 employees had come forward. They had been able to hire from local recovery homes. 2 went on to become shift leaders. One of those was Sean, who I referenced earlier. they formed a Helping Hands RFW committee, and they had seen decreases in things like accidents and injuries, lost days, and light duty days. Now I just want to touch on some resources quick. So I'm going to run through the New Hampshire ones because I kind of already mentioned that, but this will link to that video that I referenced earlier. And then in terms of resources beyond New Hampshire, you can see if your 211 number, if you're in the States, interfaces with substance use disorder support. So for example, Maine does, that's what that picture is highlighting there, is Maine's 211. You can find a virtual all recovery meeting. So all recovery is nice because it's for people in or supportive of recovery. People from all recovery pathways with any behavioral health concern are welcomed. And there's also specific groups for people, for different groups of people. So family members, LGBTQ+, women and mothers, and those interested in harm reduction. You can also educate yourself more about multiple pathways to recovery, including a variety of meeting types. So a lot of times people think of things like 12-step traditions, which would be like AA, NA, which is great. And that can be a really great pathway for people. But there's also a lot of other pathways. So if your loved one or you yourself has maybe tried a pathway and it hasn't worked, you know, don't give up hope. Maybe you just haven't found the pathway that works best for you. And then looking for peer-based agencies, and I just provided some search terms there. And then there's a book that I really like. It's called Beyond Addiction, How Science and Kindness Help People Change. And it really helps dispel some of the kind of myths around substance use disorder and recovery. Here's some resources from SAMHSA. So their treatment locator, which helps people find SUD and mental health providers. They also have a national helpline that operates 24/7. There's a national directory of recovery community organizations. We have the American Foundation for Suicide Prevention, the National Alliance on Mental Illness, and the Suicide Prevention Lifeline, which is now, if you call 988, it will help with that. Mental Health America's screening tools, mental health first aid training. I'm going to run out of time to go through our national efforts, but basically this is just a little bit more about the national community of practice we run. If you're interested in that, you can learn more on our website or email me at sam@recoveryfriendlyworkplace.com. But this is really for entities that want to develop and run their own recovery-friendly workplace initiative. And here's my contact information. And all of our socials. Follow us on social.
Okay, well, thanks so much, Sam. This is very enlightening and a lot of great information. And we will, as you said, we will include the PowerPoint presentations and the recording of this in your mailing that'll come out next week. So be on the lookout for that. And so I want to get right into our next person who will say a few words about their experience. I want to welcome Kelsey
Flinkstrom.
I couldn't find it all of a sudden. Kelsey is a human resource, a senior human resources generalist at Procon. She has a bachelor's degree in human resource management and a Society for Human Resource Management certified professional designation. And just recently, Procon started to get involved with a recovery-friendly workplace initiative to help promote the benefits from the program in their company. Procon is very supportive of Governor Sununu's initiative, and the former CEO, Mark Stebbins, also saw the benefit to helping those that might not have the tools or resources to get the help they need. The current managing directors continue to push for this program to help create a work environment that furthers employees' mental and physical well-being. So welcome, Kelsey.
Thank you so much. Yeah, so I am Kelsey. I work over at Procon. Procon is a design build company that's been around for 87 years. We have about 140 employees throughout kind of like New England. Some people are in office, some people are out of office, but we've been a part of their recovery friendly workplace program. I want to say about 2020. I wasn't here in 2020, but I think that's when we started that initiative and program here. But we continue to make changes to make our workplace better now and for the future. Our leadership team is great and continues to be advocates for those that need help with substance use and mental health treatment. Right now, I'm certified as a mental health first aider and hope to become a recovery coach in the future, just to kind of help have those harder conversations. Some of the initiatives so far that ProCon has done, we ended up hosting Dr. Gupta back in May of this year, who discussed the fight against addiction, the opioid crisis in New Hampshire, and just helpful information for what employers can do for their employees, their families, and the community. The more information that we have, the better that we can give tools or resources and help those that are asking for help, or even those that haven't reached out for help yet. It was a great experience to have Dr. Gupta talk about his initiative with us, and also hear about the recovery-friendly workplace and the other companies that ended up coming to help in making the difference with our workplace and communities with the program that they have. So far, ProCon has done training with Narcan. We did an on-site Narcan training for all interested employees. It was a great presentation to just show how to administer Narcan in a safe way, and how quickly acting it can be. We'll be doing Narcan training for our field employees. We have a couple different job sites out and about, so the online version might be best for them. And what will happen is they'll get a link through Recovery Friendly Workplace to finish that training, and then we can actually have the Narcan sprays on site with them in a just in case situation. There are a lot of subcontractors on our job sites because we are kind of mostly construction, so that'll be helpful. And then everybody that did participate in the training was able to take a Narcan canister as they needed. Right now we are working on the policies just to kind of update some of our language. We did get some great templates from Recovery Friendly Workplace. With those templates, we're just kind of rewording things that apply with ProCon here. But it just is helpful to give them resources for the employees, their family, friends, and knowledge just to help them with anything that they might be struggling with. Our goal is to raise awareness that people go through certain situations. They might take a wrong turn in life. It happens, but there is programs like this that can be very beneficial. It also helps eliminate the stigma around substance use and mental health, which I think is very important. We don't want anyone to feel afraid to ask for help or fear of thinking that they might lose their job. I know that the hardest part is asking for help, and we want people to feel safe coming to us and being able to listen to what their needs may be. And we just want to make sure that everybody has a positive journey in life and that we're helping the best that we can. And then, so right now, ProCon hopes to be the leading example of how we can help our employees, their families, and our community. We're doing one step at a time to make that difference in our current culture. We hope to include more resources, tools, and trainings in the near future to continue this awareness. So I appreciate everybody's time with wanting to be here and learn about how to make those positive changes going forward.
Okay, thank you so much, Kelsey. That's really nice to hear the perspective of an employer and how you got started and such. So, okay, so we'll move right into our next speaker, and that is Melissa Earhart. And Melissa is from the Career Source Pinellas, which is a workforce board in Pinellas County, Florida, on the West Coast. Kind of part of the St. Petersburg, Tampa metro area. Melissa is a recovery navigator in her organization and works with employers, treatment providers, and community partners to provide hope through employment to those in recovery with substance use disorders. She's been working in the nonprofit and human service fields for the past 18 years and believes no one is defined by their past decisions and everyone can have hope. So welcome, Melissa.
Hello, everybody. It is a pleasure to virtually meet you. I had a presentation on what Career Source Pinellas offered, but kind of after hearing Sam and Kelsey speak, I just want to encourage those who may may not know where to begin. So if you do not have initiatives like this in your state, or if you do not have this in your country where you currently reside, I just want to tell you how I built this recovery program here at CareerSource Pinellas. The slides will be sent to you. You'll have my contact information, but I just want to encourage you that there are steps that you can take right now, even if it's not coming from a government level for you to provide the services to these employers. And so back in January, was when I started the program, and I just began reaching out in the community, meeting those who are working those with substance use disorders directly, all of our treatment providers, and then just reaching out to employers. And so it started with one and just saying, hey, are you willing to hire somebody who is in recovery? Are you willing to hire somebody who needs a second chance? And if yes, who else can I talk to? And so that's kind of how I built this base of employers. Right now, we have about 60 employers in Pinellas County that I know that I can send somebody's email, send somebody's resume to, pick up the phone and call them and recommend somebody. These employers are willing to take a chance on somebody in recovery. And even though we don't have the initiative like a recovery-friendly workplace like New Hampshire does yet, I'm waiting for that to happen here in Florida, and just to be able to incentivize those employers this way. We do have allies and we do have advocates in the area. And so I just want you to know that there are ways that you can be proactive in this, even if it's not coming from a bigger level, and just start having the conversations. And as you are using the tools that Sam provided in reducing the stigma and changing your language and allowing employers to be open to the idea. I believe there's way more employers out there, like Kelsey mentioned, and just who are willing to see mental health and see substance use as a priority and are changing their mindset from how things used to be. So yeah, I just be encouraged, because you can do something right now, even where you are, even if you don't have all the resources. So the slides will be sent your way, but again, I didn't need to go through all of the steps that we can offer. All local workforce boards provide resources that are available to you, but you yourself can start building your program. So thank you for that, Karen. Thank you for the opportunity.
Yeah, and the workforce boards are all over the U.S. Every state, I believe, has those. Is that correct, Melissa? I think those are federally funded boards that help people get employment. So I'm so excited when I met you not too many months ago, to hear that there was actually a recovery navigator in our local workforce board. So, okay, well, we've got all our speakers, so we will move into the questions and answers. And we have some, they appear to be a lot related to labor union and that kind of thing. So the first one is, and this is, I think these are possibly more for Sam, but does this program continue, does this program include other aspects of mental health similar to employee assistance programs?
Can you repeat that question, Karen?
Okay, sorry. Does this program, the Recovery Friendly Workplaces, include other aspects of mental health similar to employee assistance programs?
Yeah, so what we do is we speak with each workplace and we find out how much they want to include mental health, and then we can be inclusive of that approach. So for example, they might tweak their declaration to expand language around, we support all of those who are impacted by behavioral health, including addiction and mental health. We also have a partner kind of program, or a program that we work, I should say, in partnership with sometimes, called the Dover Mental Health Alliance. They focus a lot based off of our model on doing like a mental health friendly certification. And in terms of EAPs, we definitely interface with those in terms of asking workplaces if they have one to leverage. And if they do, trying to get them to dig a little bit deeper to see how is it being utilized. And if it is or isn't, why is that the case? And then again, providing those options to seek recovery support. So sometimes people, no matter how much you tell them that the EAP is confidential and anonymous, they might just not feel comfortable with it. So just again, giving people those options to pursue support.
And does what type of training is there for supervisors with respect to their identity, anonymity, and confidentiality of each case that arises in the company?
Yeah,
does that make sense?
Yeah, so we have I think our business panel would be a great place to ask a question around that. I think that the panel or the discussion that we're having with the attorney, like that's part of it, is that there's certain nuances that are really consulting level or like legal level that we can't always like weigh in on, but we try to bring these offerings so that people can ask those kinds of more detailed questions. We do have a training on like 2 trainings on like how to build and grow a recovery friendly workplace. And in those we go through like FMLA, ADA. We also have handouts on ADA type things, accommodations, what you can say, what you cannot say when it comes to like prescribed medication use, mental health in the workplace. So yeah, and then, there's like things like HIPAA and stuff, but sometimes when you're in the workplace, it's not a medical entity, but we definitely stress that people aren't going to feel safe coming forward if they don't feel like it's, like say you're like, you can come forward and then you're in like a break room where anybody could walk in, like no one's going to want to have that kind of a vulnerable, intimate conversation there. Now, sometimes we do find that if people are doing like a leave of absence and then return to work agreement, they might ask that employee, the employee would have to sign off on it, but it might be as a condition of being able to come back, we need you to fill out a release form that allows us to check with your provider, not for any like nitty gritty details, but just to make sure that you're kind of complying with your program and doing, holding up your end of the deal. And then we're going to hold up our end of the deal to hold your job and to support you when you come back.
Okay. I wanted to ask Kelsey a question, and I'm not sure if you have this answer yet, but can you describe, have you seen in the short time you've been involved in the recovery-friendly workplaces, any a reduction or an improvement in the attitude kind of towards stigma of people being in recovery? Has that, have you had that effect at this point?
We haven't had any employees come to us with any issues like that. We're still trying to expand it a little bit more, make it a policy so everybody does know that it is a program that is here. I have, all the resources like right on the other side of my room. So if somebody has to come to me and talk to me about anything, I have the pamphlets, I have the cards, I have all the information. But so far there hasn't been a negative view on the program coming in, but I hope that it does create a positive one.
Right. Samantha, maybe you have some ideas about more specifically about the stigma and how maybe some other experiences with other companies that you've dealt with. Do you have any?
Yeah, I just wanted to share quick about ProCon. I think a really cool example is when we did the Narcan training. We ended up having someone there who I think was a former firefighter sharing about Narcan and able to answer some questions about like its temperature sensitivity. So just seeing any of those kinds of conversations and see people kind of be transparent about like how common it is and how much it affects us. But yeah, definitely a lot of times, probably one of the biggest things we see is that after we do a training, almost inevitably every time after, 1 or 2 people will come up to us and they will say like, I'm impacted or I'm in recovery. At one of my manufacturers, it's been amazing because we've actually had employees who are in recovery who've shared part of their story at the training. We've had employees who have raised their hand and said, actually, like I'm in recovery as well, or like I have a mental health condition. So that's really powerful to see that.
That's great. That's exactly it. Melissa, have you had any experiences with stigma and reduction of stigma in any of the companies that I know you haven't been doing this a long time, but do you have anything you can add?
All of the feedback that I'm receiving is positive, and so we can only hope that is creating just a bigger positive change. And so I also think from an employer perspective, just because of this weird job market that we have, that more employers are open to hiring somebody who may be in recovery and may need a second chance, may have a background than they were before COVID happened, just because of this workforce and this lack of the labor that we have, which is a good thing for those of us who are trying to create recovery-friendly workplaces and second chance places.
That's awesome. So let me go back to my let's see. And what this question is, does the recovery-friendly workplace includes workplace safety aspects like policies and procedures? And is there any attention towards unions or unions of workers? What do you have for that?
Yeah, we haven't done a lot of stuff specifically with unions. It's not something that's come up a lot here. I feel like New York has done a little bit more in that space. Safety is definitely huge. I think, I touched on it with the workplace injury prevention. I think that there's other organizations that really specialize in that area. So one thing that I love about Recovery Friendly Workplace is that we can't possibly be the experts in everything, but we could refer to like NIOSH or NIEHS, like different organizations that have whole curriculum around that, because they're really the experts and would be the best to have that conversation.
Right. I look at the NIOSH website quite a bit just to see what new stuff they have. And NIOSH is the National Institute of Occupational Safety and Health. That is part of the CDC. And so I try to check that out. And I'll include a link on that when we send our future information. So let's see. So here's another question, Sam. Can an employer be both a drug-free workplace and a recovery-friendly workplace? What do you have to say about that?
Yeah, so I think definitely you can be both, but I think it's really important that an employee knows. So like in our declaration, we ask employers to state that people are safe to come forward, but I think people need to know what does happen if they come forward. So if it's something like, it's a little bit hard if it's like zero tolerance in the sense that like you have a positive drug screen, like you're out forever, like there's nothing we can do from you. But then I think people need to know that so they can be empowered to maybe say like, well, I'm going to disclose, or I'm going to seek support outside of the workplace because I know that if I disclose, I'm going to be terminated. So obviously we can see that there's some tension there, because if we just tell people that it's like one strike, they're out, they're kind of getting penalized for having a health condition. But we definitely want to keep everybody safe at the workplace. So a lot of, we're familiar with a lot of safety sensitive industries that are now doing a better job creating programs where people can come forward and basically incentivizing people to voluntarily disclose instead of waiting until something's progressed in severity and they're having performance related issues or a safety incident. And I think it's all about like seeing where that intersection is of legal parameters and language and wording, and also being recovery informed and like making sure you have that supportive, non-judgmental approach within any parameters that you need to follow as a drug-free workplace.
Right, that's good. So Melissa, what would be the best way if an employer was interested in a drug-free workplace? Maybe it's a state that doesn't have a recovery-friendly workplace. What would be the best way that they could get in touch with or connect with the local workforce boards? What kind of questions would they need, or what kind of information would they need to share, and so on? So.
Well, I'm not sure if every state or every workforce board has a recovery piece of it, but I do know that every workforce board has tools and funding to help put people back to school for apprenticeships or on-the-job training. And so if you are in a state other than Florida, in Florida, it's Career Source. That's the name of our workforce boards. But in Ohio, it's Ohio Works or South Carolina Works. So every state has a workforce board. And so I would just do a simple Google search of Workforce Development Board in my county and connect with them, because there's so many resources that workforces have that are coming from a federal level that most small businesses aren't aware of, and that they are out there and ready to serve you.
Okay, very good. Well, we have reached the end of our webinar. It's 12:01. And so I want to thank our presenters one more time here for your input. This was an excellent webinar, and I know we have there's a lot of information. I've made a whole list of things I need to come back on and find out more. So just remember that we will be including the recording, the PowerPoint presentations, and a certificate of attendance. We'll be mailing those out next week. There will be a survey that will pop up as soon as I end this webinar, so please fill that out and submit that. And we will look forward to seeing you at future webinars. And so thank you all for attending, and we're going to conclude this webinar right now. So thank you so much.
Thank you.
Thanks, Karen.
Thank you.